Understanding the healthcare ecosystem, stakeholders and their interests. Welcome to the training module on understanding the healthcare ecosystem, stakeholders and their interests. This module aims to provide a comprehensive overview of the key stakeholders within the healthcare ecosystem, their roles, interests, and how various analysis methods, including SWOT and newer approaches, can help in understanding and navigating this complex environment. By the end of this module, you will be able to identify and describe the primary stakeholders in the healthcare ecosystem, understand the interests and motivations of different stakeholders, apply various analytical methods to assess and strategize interactions with stakeholders. 1. Overview of the healthcare ecosystem. The healthcare ecosystem comprises a wide range of stakeholders, each playing a crucial role in delivering healthcare services and products. These stakeholders include patients, primary recipients of healthcare services; interests, access to affordable, high-quality care and improved health outcomes; healthcare providers, physicians, nurses, hospitals and clinics; interests, delivering effective patient care, professional development, and financial sustainability; payers, insurance companies, government programs, e.g. Medicare, Medicaid; interests, managing costs, ensuring patient satisfaction, and maintaining regulatory compliance; pharmaceutical and medical device companies, developers and manufacturers of drugs and medical devices; interests, research and development, market access, regulatory approval, and profitability; regulatory bodies, FDA, EMA, and other national regulatory agencies; interests, ensuring safety and efficacy of medical products, public health protection; advocacy groups and non-profits organizations representing patient interests and specific health conditions; interests, awareness, funding for research and policy influence; academic and research institutions, universities, research labs; interests, advancing medical knowledge, securing funding for research, and publishing findings. 2. Stakeholder interests and interactions. Understanding the interests of different stakeholders is crucial for effective engagement. Here are some common interests. Patients seek affordable, high-quality care with positive health outcomes. Healthcare providers focus on delivering care, professional growth, and financial health. Payers aim to control costs, ensure quality care, and adhere to regulations. Pharmaceutical companies drive innovation, regulatory compliance, and profitability. Regulators ensure safety, efficacy, and public health. Advocacy groups promote disease awareness, research funding, and patient support. Researchers pursue scientific discovery, funding, and knowledge dissemination. 3. Analytical methods. SWOT analysis. SWOT, strengths, weaknesses, opportunities, threats, is a traditional tool used to evaluate the internal and external factors that impact organizations. Strengths, internal attributes that support achieving objectives. Weaknesses, internal attributes that hinder achieving objectives. Opportunities, external factors that the organization can exploit to its advantage. Threats, external factors that could cause trouble for the organization. PESTLE analysis. PESTLE, political, economic, social, technological, legal, environmental, is used to analyze the external macro-environmental factors affecting an organization. Political, government policies, stability, tax policies. Economic growth, exchange rates, inflation rates. Social, cultural aspects, health consciousness, population growth. Technological, innovations, technology development, automation. Legal, laws, regulations, legal frameworks. Environmental, ecological aspects, sustainability, environmental regulations. Stakeholder mapping and analysis. Stakeholder mapping involves identifying all stakeholders and analyzing their influence and interest. High influence, high interest, key players, manage closely. High influence, low interest, keep satisfied. Low influence, high interest, keep informed. Low influence, low interest, monitor with minimal effort. Value chain analysis. Value chain analysis helps in understanding the series of activities within the organization that create value for customers. Primary activities: inbound logistics, operations, outbound logistics, marketing and sales, services. Support activities: firm infrastructure, human resource management, technology development, procurement. Scenario planning. Scenario planning involves creating detailed and plausible views of how the future might develop, which helps in strategic planning. Identify key drivers of change, develop plausible scenarios, analyze potential impacts, formulate strategies to address different scenarios. Understanding the healthcare ecosystem and the interests of various stakeholders is essential for effective strategic planning and engagement. By utilizing analytical methods such as SWOT, PESTLE, stakeholder mapping, value chain analysis, and scenario planning, medical affairs professionals can better navigate the complexities of the healthcare landscape and drive successful outcomes.